Okay, good evening, everyone. Welcome to our second session for mini med school of this year. To use this computer room. Sorry about that. So welcome to our second session for mini med school this year. This session is going to be on preventative medicine. So today for our warm-up speaker, we have Loren Barcenas. She got her bachelor's in biological sciences from Florida Atlantic University in 2017 before moving to North Carolina and completing her master's degree in global health at Duke in 2019. And then she joined UNC the same year that myself and Paige did in the MD PhD program, where she completed her first 2 years of medical school before starting her PhD in the Gillings School of Public Health in the Department of Health Behavior. So her research interests include substance use prevention and intervention strategies. And she's going to talk for 15 or so minutes, and then we can take some questions before moving on to our faculty speaker for tonight. So here you go, Loren.
Hello, everyone. Let's see if I'm going to clip this. Okay. So thank you all for being here tonight. It's really wonderful to have a crowd to come listen to us talk. As Matthew said, my name is Loren, and I am a third year in my PhD at UNC. And before I get started about managing stress, I just want us all to take a deep breath in, hold it at the top, exhale. Okay, let's get started. So if you've ever had a looming deadline or your parents pressuring you to get good grades or had to make your paycheck stretch to last a month, then you have experienced stress. You might be familiar with the tension in your shoulders, maybe a headache, maybe chronic pain, but how does the sense of pressure translate biologically into these physiologic bodily sensations? On the molecular level, we have a hormone called cortisol, which is known as the stress hormone. So cortisol gets released when you experience fear, anxiety, injury, and it's coming in to try to regulate your body and get you back to balance. So where does this cortisol hormone come from? It is released from the adrenal glands. These glands sit on top of your kidneys. It looks like a little hat. So how do the adrenal glands know when to release cortisol and how much? Well, we have a very complicated system in place, which is called the HPA axis. H stands for hypothalamus, which is a part of your brain that secretes a hormone, which talks to the pituitary gland, which is a little gland underneath your brain, which secretes another different hormone. And there's a complex feedback regulation system, and it talks to the adrenal glands, which then in turn releases cortisol. So I won't get into all the finite details of how the HPA axis works, but it is working to make sure our hormones are in balance. So to take us to a little bit of biology, in the nervous system, we have two sides of your nervous system. So you can think of this like two sides of the same coin. You have the parasympathetic nervous system, which is known as rest and digest. So when you're relaxing, eating, using the bathroom, that is what this part of the nervous system is regulating. But when you're faced with a stressor, then it activates the sympathetic nervous system. So this is the part of your nervous system that gets you really activated, ready to go. And we like to talk about when you're facing stress, you are either going to face this with a flight, fight, or freeze response. So we can think of an example like prehistoric times. You might be fighting or trying to hunt a woolly mammoth. Very stressful, right? So you are either going to want to fight this, run away, or play dead. And that is where your sympathetic nervous system comes into play to help you survive this threat. So cortisol gets released. You're about to face off with a woolly mammoth, and then cortisol goes into your bloodstream and it starts to increase your blood sugar. So you want to get energy to all your body. You want to feed your cells, feed your muscle tissues, and that's what increasing your blood sugar is going to do to help you run or fight. You also want to have heightened memory and attention. So that way you're really hyper vigilant, you're paying attention, you're alert, you're on the lookout for other threats, other predators, and an increase in your blood pressure. So again, this is going to help you get oxygen to all of your muscle tissues, helping you to run or fight. And so we want to prioritize getting all of the energy into keeping you alive in this moment. So we are going to take away energy from other parts that are not important right now. So the immune system, right now we're facing a woolly mammoth. We are not worried about healing a wound or fighting a virus. So we're going to take resources away from that part. We're going to decrease serotonin, that's your happiness hormone, and decrease sensitivity to pain because your body is anticipating that you're going to be experiencing pain. So it's like, okay, well, we can't really worry about that right now. We're just going to worry about surviving the moment and we'll deal with that later. So all of these stress responses are really vital when we have a temporary stressor. We like to call that an acute stressor. It's not lasting or persisting a long time. So all these things are going to help you survive in the moment. But these days, we are not fighting woolly mammoths. We have modern stressors that are much more longer term and sustained. So we call that chronic stress. Now, when all of these acute stress responses persist over a long time period, they start to wear and tear on your body. So what was really helpful in the short term is not so helpful in the long term. And it can lead to these physical manifestations that you probably associate with the feeling of stress. You have headaches, chronic pain, cardiovascular disease like stroke or heart disease, diabetes, obesity, a weakened immune system, insomnia or trouble falling asleep and staying asleep. So we can kind of see how all of these things that were once helpful are now harmful in the long term. So you're thinking, okay, well, we can't really get rid of stress in our lives. So how can we manage this chronic stress? And we'll get there, but I have a slide before that. So the theory of optimal stress. So we kind of talked about how a little bit of stress can be a good thing. It can get you motivated. It can wake you up. And so there is a bell curve to this. So on the far left, we have bore out, which is basically you have no responsibilities, no pressure, and you're bored because there's no reason to do anything. So why should you do it? Which is not generally where we want to be. But then you move into the green zones with a little bit more pressure. So you might have a deadline. You might have someone encouraging you, motivating you to do something. You feel really empowered and like you're able to get it done. And this leads to optimal performance. You have the resources that you need to get something done and you're seeing the results that you want to see. So it's really encouraging. And then you might be thinking, well, if I increase the pressure, my performance went up. What if I increase the pressure more? Maybe my performance will go up even more. And that's where you lead to the zone of delusion, because more pressure does not necessarily mean a better performance. What's going to happen is you get more pressure and then you have less resources to actually complete your goal. And it starts to lead to burnout because you're getting frustrated that I'm working really hard. I have a lot of pressure, a lot of stress, but I'm not seeing the results that I would expect to see. So that's why you want to try to stay in that middle zone of having some motivating pressure, but not too much to where you feel like it's too all-consuming. So stress management, how can we stay in that green zone? You've probably seen these recommendations before, but I want to focus on the science behind some of them. So exercise. We talked about the fight or flight. Your body is getting geared up. It's ready for a physical fight or running. So that's why exercise and moving your body can make your body feel like it's completed the stress cycle and it can turn off the stress response. Your body's like, okay, we have fought the stressful thing, it's gone, and now we can relax. So that's a little bit about how exercise can help with stress management. Meditation, you might have heard that, breathing and listening to a guided meditation can help you with stress. And we actually have evidence of that through a meta-analysis. So if you haven't heard of a meta-analysis, it's a type of research study where we aggregate the results of many papers of research into one paper. So we're really getting as much information as possible on this one topic. So that makes it a really reliable source of information. So we know we can trust the results of this research. And sleep. Sleep is a tricky one because stress can lead to poor sleep, and then poor sleep can lead to more stress. So this is one where you can start to feel kind of caught up in it. But to try to improve sleep hygiene, we have some simple but not always easy to follow sleep hygiene tips. So limiting screen time before bed. I know I am a victim of not putting my phone down before bed, but limiting light exposure in general can help you to fall asleep because it helps you to regulate different hormones that control your wake-sleep cycles. And on the bottom, we have melatonin, which is one of those types of hormones that helps regulate your sleep-wake cycle. And so that you can actually buy at a grocery store, or wherever you can buy medications over the counter. So melatonin can help you to fall asleep and stay asleep. And avoiding caffeine at bedtime, relaxation, like a warm bath or meditation. So if you meditate, you can reduce your cortisol levels and maybe get you more relaxed for sleep. So getting more bang for your buck with that one. And we also have massage therapy. So it kind of goes without saying that getting massage is relaxing. But we also have scientific evidence that moderate pressure massage therapy has resulted in decreased cortisol levels. So there is science to back that up. And a review paper is very similar to a meta-analysis, but it just is a summary of a bunch of papers that are out there, but it doesn't have a numeric statistical component to it. And finally, social support. I am in the social sciences, so I couldn't leave without talking about social support. Having friends and loved ones around you not only helps you to solve your problems and face your stressors, but it's also proven that it makes the adverse effects like chronic pain, diabetes, obesity, all those physical manifestations of stress that we talked about, less impactful. So not only decreasing your stress levels, but also the impacts of stress. So thank you for your time and attention. I'd be happy to take any questions. Yeah. Yeah. Yeah, so I'll repeat the question for everyone on Zoom. Can incorporating some of these strategies reverse chronic stress for someone who's experienced it for 5 years or more? I would say yes. And I also think about it like, what is the downside of trying some of these therapies? So meditation, that's something that you can do for free. You can find guided meditations on YouTube. There's also subscriptions that you can pay for, but it's something that there's really no downside to trying it or doing it. Maybe if you tried it doesn't work, you might be a little bit frustrated. But I think if there's no downside but potential upside, then I would definitely recommend that. Of course, when it comes to something like massage therapy, that might be something that's more expensive that some people might not be able to engage in. But again, if you are able to, I think it'd definitely be worth a try. Yeah, does that help answer your question? Yes. Yeah, so there is some like complexity to using cortisol as a measure of stress specifically because cortisol is also used to regulate other things in your body. So that's why the whole HPA axis is like really complicated with when cortisol is released and how much, because it's something that's released in the morning to help you wake up in the morning. But I think to answer your question, once you are less stressed, does the stress have a lingering effect? Is that kind of what you're asking? Yeah, I would say, I mean, I don't know a specific time frame on once you're stressed, like how long does that impact linger? But I would say if it's kind of short term, then that impact will go away. But it's when stress is kind of sustained over longer periods of time that you start to accumulate those that wear and tear on your body. So it's kind of like when you're exercising. If you exercise a little bit and then rest and recover, you'll be fine. But if you constantly are exercising, never resting, then you could be injured. So I kind of think of it like that. Yeah. Yes. Yeah, so one of my PhD classmates is actually doing her research in how stress kind of accumulates in the body. So I'm not the expert on this, but there is something that's called allostatic load, which is something you can look up, which seems like you are familiar, which is not like something that you can take someone's blood and measure it. It's an index. It's like an accumulation of different biomarkers to measure the overall level of stress, but there's definitely a component of structural stressors that can impact different populations. So populations with lower socioeconomic status can be particularly impacted because they have less resources to alleviate that stress, and poverty is stressful too. So it can definitely wear and tear and have less time for recovery.
Is if you take melatonin to fall asleep, won't you develop? And how does it impact your health?
Again, I'd like to say that I'm not an expert, but I don't believe that melatonin is an addictive substance. I think if you have issues with insomnia, you might feel like it's easier to fall asleep with it, so you might want to use it more often, but I don't think from a biological standpoint that it would like activate the parts of your brain that are involved in addiction. What was the second part of the question? Oh, I think you'd be okay. It's not even a prescription drug.
I have another question about excitement versus stress differences.
I think that's a great question. I'm not sure that I would know the answer to that. Something for future research. Yes.
We're going to take about a 5-minute break before we start the.
Thank you.
Okay, hi everyone. We're going to get started. So for our second speaker tonight, we have Dr. Emily Cetrone. She did her undergrad at David Siddons College and then went to University of Virginia for her medical degree. After that, she completed her residency at Brigham and Women's Hospital and then completed the Geriatric Medicine Fellowship at the Boston Medical Center before joining UNC as an assistant professor of medicine in the Division of Geriatric Medicine. So Dr. Cetrone is going to give the second part of our talk. So let's give her a welcome. Thanks.
Hi, everyone. Thanks so much. Again, just thanks for being here on such a rainy, cold night. So I'm glad everyone made it out. And I just want to say again, that was such a great talk. My cortisol level is high right now, probably, because I'm excited about this talk, but also a little nervous. So it's good. Some of what I'm going to say actually harkens back to the talk as well. So I think it'll be some good space learning. So as mentioned, I'm a geriatrician, but what I'm going to talk about tonight does apply to people of all ages. Not only because I know that a lot of us have, family members or friends that are of various ages, but also, a lot of times when I see patients in my clinic, a lot of what I recommend is best done early in life as possible. Okay. And I please welcome throughout the talk, if you have any questions, just go ahead and raise your hand. And if anything comes up on Zoom that you think is relevant, please feel free to share. Okay. So these are our objectives for tonight. So hopefully by the end of my talk, you'll be able to understand the signs of normal cognitive aging, incorporate key elements of a healthy exercise routine, choose foods that can help delay cognitive decline, make changes to your routine to help you get better sleep. So we'll be able to come back to some of those questions. Recognize why treatment of hearing loss and mood are helpful for your cognition, and avoid medications that put you at higher risk. So unfortunately, as we get older, there are many, many things that are part of normal physiologic aging, right? And I'm sure people experience that in their day-to-day life with getting out of bed, going upstairs. There are changes to every system in our body. So when we think about our musculoskeletal system, for example, there could be changes in like the connective tissue that connect joints and can lead to things like arthritis. There can be decreased muscle mass. It's harder to maintain that muscle mass as you get older. In our cardiovascular system, there can be decreased responsiveness to stressors or to other things that are happening in the body. So the heart rate can't compensate as much, blood pressure can't compensate as much. And the brain, unfortunately, does not avoid that. And so there's many parts of that we see in our normal life that are part of normal cognitive aging. When we think about cognition, it's helpful to think about the cognitive domains. So the most common one that people talk about is memory. And when we think about like early signs of more serious conditions like dementia, people first recognize sort of memory decline as one of the key signs. That is just one cognitive domain, though. The other cognitive domains include visuospatial. So how are you getting around in the world? How are you driving? How easily can you complete a puzzle at age 45 compared to at age 15? Language is one of them. The tip of the tongue kind of phenomenon. I'm trying to think of the right word and I can't think of it. How easy is it for you to learn a second language, for example, or a third language or fourth? As you get older, all of that gets harder. Personality actually is a cognitive domain as well. So some cognitive changes can result in changes in personality. So it's important to think about all of these domains when we think about normal cognitive aging. And unfortunately, decline is going to be part of that aging. And it begins actually in our 40s, so much earlier than people think. It's mostly highlighted by some mild changes that progress until you're about 70s, and then there's going to be a steeper decline after that. Some characteristics of it include like a mildly slowed speed of processing, so it's harder for you to sort of pick up on things that are going on. Probably no one can truly multitask, but that certainly gets much harder as you get older. There's impairment in name face recognition. So you run into somebody and you haven't seen them in 6 months, 8 months, and you're like, I know their name, and you can't come out with it. That can be a part of normal aging. And then slowed retrieval of old information, retrieval errors. I am almost 40 and I can already feel this, where I watch a movie and I can't think of the name of the actor as much as I could even 20 years ago. So those are all signs of normal aging. And I do just want to take a brief pause and say this talk is not about dementia itself. But of course, if you're ever concerned about someone that you know or yourself, and you're wondering if any of those changes that they're experiencing are a part of normal aging, I really encourage of course, you to bring that to your doctor or that family member. And if you want to talk about that, a little bit longer, we can also have some time at the end or after the talk. So what's important, though, is that this cognitive decline is not consistent across everybody. It can really vary in an individual and across individuals. And there's lots of different factors that can affect it. And so that's what the goal of this talk is. How can we slow it down? And that comes back to this concept of cognitive reserve. So there's kind of mixed opinions about this, but the thought is that in the early part of your life, probably up until age 25, actually, is what we think in terms of building cognitive reserve, you can build up that reserve through experiences in your life, right, that you have, reading different various experiences. And that's why there are so many factors here that unfortunately are not within somebody's control, just to also name that as well. Very important to this talk. But you kind of build up that reserve. And then the reserve is pretty stable for a while. And then in our 40s is when we start to have that decline. And the things that affect that decline is what we're going to talk about tonight. And the reason I think this topic is important is because it has been shown recently that possibly up to 50% of dementia, the more serious cognitive changes, is actually preventable. And that's where we want to look at tonight. So the first biggest topic that has the most evidence out there is exercise. Also to mention briefly is that a lot of the things that I'm going to talk about are not just beneficial, right, for cognitive aging and slowing that down. They have a lot of benefits across the health spectrum. So they have a lot of benefits for reducing stress, for example, high blood pressure, cardiovascular disease, because they're all really tied into each other. So why do we think exercise is helpful for this? It all comes back to sort of decreasing those risk factors that are going to impair cognition. So decreasing the risk of things like diabetes, high blood pressure, heart failure, strokes, that are going to overall impair blood flow to the brain. So the vascular network to the brain is very complex. There's the large blood vessels that you think of, but then there are much smaller blood vessels throughout the brain, and those can be very easily damaged by inflammation. And inflammation can come from things like chronic stress and chronic diseases. And exercise is thought to play a role in lowering that. So what are the main tips for that? So first, just try to move more throughout the day and sit less. So any little bit that you do, and that's, I think, another thing I want you to take away from the talk, right, is it's not an all or none. I don't want you to walk away saying, I have to check everything off, right, that she talked about. Any little bit is going to be helpful. So moving more throughout the day, sitting less. The goal in most of the studies is this 150 to 300 minutes of moderate intensity aerobic exercise, which sounds daunting. And of course, it's good if you can get out there and you can power walk. It's good if you can run and cycle and those, but it can be other things as well. Raking leaves, doing chores, all of that, anything that really targets your heart rate and gets it to your target heart rate, which will vary depending on your age, of course. And I'm also happy to answer questions about that, is going to fall into this moderate intensity exercise. Importantly, though, too, is we want to balance that out. We don't want to just do, cardio and things like that. We want to do muscle strengthening exercises, flexibility, balance, kind of all combining that together. We know is very important for this. So the common missteps when we think about exercise is if you're going to start a brand new routine, it's a good idea to talk to your doctor about that beforehand, just because that way then they can sort of look at your medical conditions, medications, kind of come up with a good prescription for you. You don't want to do too much too soon. So really take it slow. And I find it's very helpful to kind of write out a program for either yourself or come up with it with a buddy or with your doctor where you have very specific goals, because not only then is it a little bit more, it's easier to meet those goals, but then you kind of know the pace that you should be increasing at. And then finally, I see people that, don't have a balanced routine. So they'll go out there and they'll just run, and then they end up injuring themselves and kind of defeat the purpose of everything. So those are the key kind of approaches there. In addition to exercise, diet is going to be a big area where we can make significant improvements to try and slow cognitive aging. So the best studied diet out there is the MIND diet, which is the Mediterranean DASH diet intervention for neurodegenerative delay. And just as the name applies, it actually combines two diets out there that are fairly well known. So the Mediterranean diet, you might have heard of, comes from the Mediterranean area and involves a lot of whole grains, fish, things like that. And then the DASH diet, which is a diet geared towards lowering blood pressure through looking at things like salt and increasing other electrolytes like potassium. So they actually combined aspects of each of these diets to say, okay, do we think that this could actually help slow down cognitive aging? And they followed a group of older adults over 10 years. And those who followed the MIND diet had slower rates of cognitive decline. And part of that absolutely was because each of those diets, has been shown to help control some of these risk factors that we've been talking about for cognitive decline, like heart failure and these chronic diseases. But it was also independent of that. So looking a little more closely at the diet, is it really highlights plant-based foods and limits the intake of animal and high saturated fat foods. It also recommends specific brain healthy foods to include and some unhealthy food items to limit, which we will look at. I think also, again, instead of sort of thinking about like, I have to write down exactly the servings of what I'm about to show you, it's more of the approach, right? When I talk to my patients, I like to say, okay, let's think about things we can add in and not so much worry about, meeting this exactly. So prioritizing as much as possible those fresher foods, things that don't come out of packages, things that don't have as much salt, saturated fats, etc. So this is the, this is the list that was technically in the MIND diet, okay? Again, I will tell you, I'm not sitting there and calculating exactly how many servings of things I have every single week, but if sort of putting these forward in your diet has been shown to have the most benefit. And then the don'ts, in other words, things like pastries, sweets, red meat, cheese, fried foods, butter, margarine, those types of things are also going to be limited. Another aspect that's been shown to help with cognitive decline is hearing loss. And the earlier the better in terms of treating hearing loss. The first question is, how does hearing loss actually contribute to cognitive decline? And there are a few different theories about this. So one is the common cause hypothesis, which is that the same things that lead to hearing loss potentially also lead to cognitive decline, because hearing is, part of our nervous system. There's a nerve that controls that. So the thought is, okay, well, if there are things that are affecting those other cognitive domains that I was talking about, maybe it also affects hearing. Another theory is sensory deprivation. So if you're not hearing what's around you, that can affect you in many different ways. When we think about one of the cognitive domains that's most common, memory is very tied into attention, and that's gonna come back a couple more times in this talk. If you can't pay attention to something, you can't remember it. And I'm sure everyone has experienced that, right? Occasionally, when you're really stressed about something and you're not able to pay attention to something, you'll find yourself getting more forgetful, or you're not able to do as many things as you used to. And so if you're not able to hear something, similarly, perhaps that's also contributing. There's also a theory of cognitive resource depletion, basically that you're using so much energy to try to hear something that it's actually taking away from your brain's kind of glucose and energy to do other tasks and to learn and to gather more information. And then finally, social isolation and depression have been shown to correlate with hearing. And so if you're at a large gathering or a smaller gathering and you can't hear what's going on, you feel like you can't participate, you're going to be less likely to go to those gatherings, going to withdraw. And we know that social isolation in particular and loneliness have serious health consequences, as much as smoking half a pack of cigarettes a day, actually, to give an example. Probably the truth, right, is a combination that hearing loss probably contributes in all of those different ways. So what can you do? So I recommend getting your hearing tested regularly, and generally speaking, recommendation, even after starting at age 50, it's not a bad idea, because we do know that the earlier the better, and encouraging family members and everyone to do the same. It can take a lot of time to adjust to hearing aids. And of course, it's still like a part of aging that I think is very hard for a lot of people to accept, which absolutely makes sense. But I think when you think about how that balances with some of the benefits, this is very much tied in to sort of the rest, in the sense that medical conditions are deeply impacted by a lot of what I've been talking about. You may. Oh, yeah.
I think we lost internet connection there for a second.
We good? Okay. Oh, yeah. Thanks for fixing that. So I have one sentence here that says, keep conditions such as diabetes, high blood pressure, and heart failure under good control. And I don't mean to say that that is a simple thing at all, okay? I just mean to say that that is obviously also, a whole topic in itself. But we do know that those conditions are going to affect your cognition, because your brain is getting, the blood flow from the rest of your body. And the inflammation and the poor blood flow that can result from these conditions is going to impact that. And so there's the medication side of things, but there's also the rest of what we've been talking about that we know that things like exercise and dietary changes can also help with some of that. And I don't mean to keep harking back, but stress reduction and those techniques, I thought it was very good. And then, especially as a geriatrician, but across the board, I think it's really important to emphasize about, taking medications prescribed and discussed with your doctor. That's because there's so many over-the-counter type medications and supplements, or that you might get from someone else, that can really impact your cognition. They can have a lot of other important health impacts as well, but thinking about this topic. So for example, one of the most common over-the-counter medications, diphenhydramine, which is the brand name is Benadryl, that can really have significant effects on your cognition. And it's cumulative. So, over life as you use that medication. And that's because that medication is in a category of medications called anticholinergics. So they reduce acetylcholine in the body and the brain, and that is actually a neurotransmitter that is decreased in Alzheimer's disease, for example. So thinking about how those medications over time can reduce that in your body can have negative effects. Now, when someone takes them and they are in their 30s or 40s, they're not going to notice sort of an impact in the day-to-day necessarily in terms of their cognition. They might be sleepier, et cetera, but over many years that can have that effect. And then as you get older, you're going to be even more sensitive to that because you already are going to have less acetylcholine as you get older. And other medications that sort of fall into that anticholinergic that are very common are things like hydroxyzine, oxybutynin. Those are just some medications, but it's a good idea to sort of ask when you're thinking about starting anything. And then other common medications that can impact cognition are going to be anything that impact the brain. So certain pain medications, certain anxiety medications. People ask a lot about supplements in terms of what is beneficial and what is not. So, the short answer is that there's no strong evidence for supplements in terms of helping cognition. That being said, I think that I'm always open, especially, for my patients, to balance the risks and benefits there. And so I always encourage people to bring me what they're interested in trying. And as long as there is no negative effect that I'm worried about, that it's not going to affect one of their other medications or negatively impact one of their, conditions, I think it can be a conversation. So I'd encourage you to kind of be open about that kind of thing, because, science sometimes is a little bit behind. And so I think it's important to kind of keep that whole picture. I'm going to spend a little bit of time on sleep. I know we talked about it a little bit, but it is just really, really important when we think about stress, diabetes, high blood pressure, and cognition. Okay. So first, sleep apnea is a really common condition that often gets underdiagnosed. So there are two types of sleep apnea. There's a central sleep apnea in which the brain actually doesn't tell the respiratory system to breathe normally. That is much less common, so I'm not going to spend as much time talking about that. The more common one is called obstructive sleep apnea. So there's more of a physical aspect that prevents your respiratory system from working normally overnight. And what happens then is there are periods overnight where you have apnea, which means not breathing. So your periods of night where you're not breathing. And so you'll find that these people with sleep apnea are going to gasp for breath in the middle of the night. There's going to be snoring. Those are some of the common symptoms that you might have heard about. Sometimes, though, those aren't always recognized. And so other symptoms to watch out for are things like daytime sleepiness. So really I cannot stay awake in the afternoon, even though, I did sleep, 7 to 8 hours, I was in bed. Waking up and feeling like you didn't sleep, even though you did. If you're having those types of symptoms, I think it's a good idea to sort of talk to your doctor about them and think about sleep apnea. Of course, there are other causes of that, but it does tell us, no matter what, that you're not getting a restful sleep. If you're in the bed and you're asleep for 7 or 8 hours and you wake up feeling like you didn't. Treatment of sleep apnea with like a CPAP machine or other therapies can help with cognition, blood pressure, like that. And then melatonin I would not consider a sleep medication, just sort of as was mentioned, but I actually do recommend as much as possible avoiding sleep medications. Now, I have a couple of reasons for this, and I don't mean on a very occasional basis, right? Like if you need to take it a couple times a month, I mean on a nightly basis. So the first reason is that most sleep medications, again, we're not talking about melatonin, but like prescribed ones, they do come with the risk of dependence. So your body's hormonal and circadian rhythm are going to change as a result. And so they're not going to work as well the more that you use them, and it's going to perpetuate the difficulty with sleep. And then the second reason is that most of those medications fall into the category of medications that I was just talking about on the previous slide that can have negative impacts on cognition. They either kind of work on the actual neurotransmitters and they can affect it that way, or they can cause like daytime grogginess, daytime sleepiness that are going to make things like paying attention, using your cognitive reserve a little bit harder. And then, finally, they do also have other risks that come with them, like falls and that kind of thing that you really want to keep in mind. One of my biggest tips for people who are struggling with sleep is to stick to the same sleep schedule. So I'm going to briefly talk about something called sleep restriction therapy, which sounds miserable to me. But what happens is a common pattern is that someone will be unable to fall asleep. Their perfect sleep schedule, let's say, is 11 p.m. to 7 a.m. And then they get into a place where they're unable to fall asleep until at 11 p.m. And they toss and they turn and they're looking at the clock and they don't go to bed until then 1 a.m. They went to bed at 1 a.m. So they said, well, I need to sleep in a little bit more. So then they wake up maybe 7:38 and then they stay in bed until 9:30. And then they get out of bed at that point. And then that night, they also can't go to sleep at their normal time. And it becomes, a cycle in that way. And then the psychological impact of insomnia kicks in, where there's so much anxiety and anticipation about not being able to sleep because it's one of the worst things, right? You're lying in bed, you can't fall asleep, and you have everything on your mind. So sleep restriction therapy is an extreme form of like this sticking to the same sleep schedule, where you sort of set a schedule and you say, okay, no matter what, I'm going to go to bed. I'm not going to go to bed any earlier than my goal. No matter what, I'm going to get up at the same time, even if I only got 4 hours of sleep that night. And it helps you then get back into your regular routine. As mentioned, exercise can also be helpful for sleep. There's some debate about the ideal timing for exercise for sleep. The thought is probably, in the afternoon. That doesn't work for a lot of people's schedules, right? I can't, exercise at 2 p.m. So I say really, is that any time that you can fit in exercise is going to be better, and it's going to be better for sleep, and it's going to be better for mood. Yes, if you do something very in the cardio department and you try to go to sleep 15 minutes later, that it's probably going to be harder. But generally speaking, I still think it's going to be beneficial, and it's probably going to help you have a deeper, higher quality sleep. And then the advice that I also give about eating and drinking is the recommended time to avoid is 3 hours before bed. And this is for a number of reasons. Again, not saying that everything, right? You don't have to meet all of these perfectly, but kind of getting towards these goals. So the first reason is that acid reflux. And even if you're not someone that has classic symptoms of acid reflux, which is the acid in your stomach kind of coming up through the sphincter in your esophagus and then coming up through your esophagus, either causing a burning feeling or the acid getting into your lungs, causing a cough or leaving a bad taste in your mouth. Those are just some symptoms. Even if you're not aware of them, they could actually be subtle enough where you're not sure you're having them when you're awake, but they are impacting your sleep. So that's one reason. And then the second reason is just having to go to the bathroom in the middle of the night. Obviously, that also gets harder as we get older, but at any age, your sleep being interrupted by having to use the bathroom because you had a bunch of water before bed is going to make a difference. And then caffeine is a very individualized thing. So people process caffeine very differently. But I do think if you're having trouble sleeping, it is good to look at your caffeine consumption and try to make some adjustments. So maybe for you saying, okay, I'm only going to have it in the morning. And that's where I I recommend people start with. Other people, as long as they have it before 2 p.m., they're good, so that could be a little bit varied. And then also there are some people who they've seen that caffeine lasts for like 18, 19, 20 hours in their body. And so for some people, it might be where they really have to completely get it out of their system. I'm sorry, I don't know why I'm so bad at advancing this. There we go. So mood is also going to be a really important factor for cognition. Acutely, so when we think about somebody that has depression or is struggling with an episode of depression or has a lot of anxiety, but then also like in the long run, when we think about, decades and years of depression or anxiety. One of the big reasons is that it does affect your attention. So going back to that. And so people who are depressed or anxious, if you've ever seen kind of questionnaires that maybe you got at your doctor's office or somewhere else, right? Attention is one of the symptoms of depression and anxiety. And so if that is impaired, it's going to make your cognitive processing harder. And then the other thought is that, because of the neurotransmitters involved in things like depression and anxiety, there's probably a similar role in terms of over time decreasing that cognitive reserve. So as much as possible, sort of trying to seek treatment for those, whether that's therapy or in certain cases, the right medication, is also going to be helpful for your cognition over time. And then alcohol has a little bit of some mixed evidence when we think about mild to moderate. You might have seen this in the news recently. There was so much back and forth actually about sort of the risks and the benefits. I'd say without doubt that we know that heavy drinking, so more than 3 drinks per day, so when we think about a whole week, is going to be associated with an increased risk of cognitive decline, probably through like direct impact on the actual brain tissue and the neurons. And there's in that mild to moderate range, probably we're a little bit less certain about how that's going to impact somebody's cognition. I liked what Loren had said in terms of when we think about anything we do and any recommendations, we always want to weigh like the possible risks and benefits, right? That's how I always talk to all of my patients. And so I think the benefit of minimizing drinking alcohol as much as possible kind of outweighs any possible risk of, minimizing it, because there hasn't been, even there's mixed evidence about how harmful it is pretty clear evidence now that it's probably not helpful for anything. And so I think minimizing as much as possible would be my advice. The caveat being that we can try to balance as many of these risk factors as possible, but they don't always equal each other. And they're not always, you can't always quantify them, right? There's a lot of science in medicine, but then there is a lot of art in medicine as well. So for me, like the biggest example that I will get asked is, but what about, my social hour that I have with my friends on Friday, and we have a happy hour, we go, what is the benefit of that socialization, that spending time with family and friends? That probably has a really high benefit, right? And so that's why I think it's important to think about these things kind of globally. And I say with alcohol, minimize as much as possible. All right, I'd love to take questions now. If y'all have any questions about any aspects of sort of those things that I talked about or anything else that you're wondering in terms of normal cognitive aging and what we can do to help with it.
And that starts younger taking those, is there a point at which they're no longer beneficial?
Yeah, so the question was about the supplements such as Prevagen and kind of the mechanism of how they work. And then if you kind of start taking them younger, or you say, like, if you continue to take them, will you eventually lose the benefit? If I understand that correctly. Yeah, so Prevagen, I will just also name that Prevagen, things like that, fall into the category of, so far, there hasn't been any evidence that they do work in terms of slowing cognitive aging or helping with dementia. Most of those supplements, though, when you look at sort of the list, They also don't carry significant harms. Like they're not, supplements that are going to increase risk of bleeding, things like that. So that's why when I talk about it with my patients, it's probably not going to harm anything. I do sometimes say, though, they do cost money. And so over time, maybe putting that money towards things that maybe have a little bit more evidence, like fresher foods and things like that, is probably better. That being said, most of them work. They're like higher doses of common vitamins as well as natural sort of plants and things like that. So the thought is about kind of reducing inflammation in your brain and body, and then also kind of helping to build like the building blocks that come with sort of like neurotransmitters and things like that. No, there would, but if like, let's say 5 years from now, they say, oh, actually Prevagen has been shown to have a benefit, the way that it works, I don't anticipate that sort of, if you took it regularly, it's not going to lose its effectiveness, because again, it's not like some of these sleep medications or other medications like that really work on specific transmitters. They're kind of more about the building blocks. Was that? Okay. You're welcome.
You mentioned that Benadryl, are like daily allergy medicines, like they have that same impact?
That's such a great question. And I love that you asked that. So no, Benadryl is not only is it in that category of medication that I talked about, right? But it is an antihistamine. So it works on histamine, which is a different molecule. And so when you take Benadryl, it is going to be helpful for things like itching and that kind of thing. And so like occasional use, right, is not going to be a problem. But for daily use, highly recommend instead that type of medication. So Cetrone, which is Zyrtec, Allegra, which is fexofenadrine. I'm just saying the generics and the brand, because when you're in the store, I always just recommend to pick the cheapest because it's the same exact ingredients. Those don't have any of that anticholinergic effect, and they really work on histamine. Technically speaking, they're supposed to be non-sedating, but I do find that for a lot of people, Cetrone, which is Zyrtec, actually is a little bit sedating. So it's also okay to sort of try different ones or like move them to the night, even if they're the super long acting one. But no, those you don't have to be worried about in that department.
You have a question from Zoom. Does cortisol quantity reduce constant production? And if it does reduce, then does that affect your ability to have that fight or flight response as you get older?
Yes, it does. So the amount of cortisol that your body is able to generate does reduce as you get older. And then because of that, your stress response is not as robust, which kind of plays into some of that, your body's ability to sort of fight infection, or, fortunately there's not too many mammoths around, but things like that. Yeah. And with sleep, the circadian rhythm can also be impaired with aging. So that just further impacts that. Yeah. Great. The question was, what are the effects of iron deficiency on the cognitive decline, basically? That's a really, really good question. I think I have a partial answer, and then I'm happy to also look into that a little bit more if anybody else in the room has any additional thoughts. Right now, though, the thought is that we know more and more that iron deficiency is definitely being underdiagnosed, and that we need to really, pay attention to it a lot more, because we know that it does play a role in things like depression and poor sleep and fatigue and low energy. And so, my initial thought to your question is probably then that would have a negative impact on cognition and sort of some of the things that we've been talking about because of that secondary mechanism. But I'm not sure about a primary sort of mechanism.
Do things like games, like puzzles, like Sudoku and things help with cognitive decline?
The question was, do things like games, Sudoku, puzzles, things like that help with cognitive decline? And the short answer is yes. So we're practicing those different skills and thinking about those domains that I talked about. So like memory and visuospatial has been shown then if you can continually do it, has been shown to kind of keep those areas fresh. So to keep your memories alive. A lot of people say like things like smartphones and other devices are probably making some of this worse, right? Because we just have it all right there in our phone. We can use GPS and we can look at our note and we don't have to really try as hard. So the thought with those games is that can help activate that and really use use your brain in those creative ways. But I offer a caveat being that I don't want you to force yourself to do those game, like a specific type of game, if it's not something that you enjoy. So if you enjoy a crossword puzzle, then that's great. But if you're someone that you've never enjoyed a crossword puzzle, that does not have to be your game or activity of choice. You can find a different one that sort of does appeal to you. And again, just going back to that, like how much are you really going to be able to keep doing something if you really hate it that much and it's not your job? And then, also like there's lots of just different approaches out there.
One being cortisol the same cortisol, and the other being how can the cortisol level be monitored? Time or out of
Do you want to take any of those, or do you want? Okay. So cortisol is the body's. I guess it was from Zoom, right? So everyone heard the question. Okay. So cortisol is like the body produces it. Cortisone is what we kind of see in a lot of medications, but sort of like an artificial version of it that we're able to give. So like hydrocortisone is an example. There's a topical version of that. There's a pill version of that. So that's the difference between there. And then measuring cortisol levels is tricky because there is a normal variation throughout your day-to-day. And this will vary a little bit if you are chronically on a different schedule. So like if you chronically work at night, this will be different, just as a caveat. But for most people who sleep at night and are awake during the day, their cortisol level is going to fluctuate throughout the day. And so the timing of when you check it is going to be really important. It's also hard to know if a high cortisol level is actually abnormal. A low cortisol level at certain parts of the day, we can say for sure is abnormal, and we can do some stimulation tests to try to figure that out. But when we're worried about sort of high cortisol levels, it can be high for a number of reasons. And so we typically use like other surrogates to know if someone really is like chronically high levels of stress. But I would recommend, getting those tests done. Yes, lab work through your doctor. Mm-hmm. Yes. So the question was, does learning as we get older, does that actually also help to slow the cognitive decline? People who are lifelong learners. Absolutely. So learning a new skill has a lot of benefit for slowing that decline. And again, it can be something that appeals to you also and interests you. So it can be purely for fun. I said that it's harder to learn a new language, right, as you get older, but it is a very, very good thing to try to do. Even the goal is not to become fluent, right? Just a little bit. It's a very good way to stress your brain. I mean, it's a simplistic way to think about it, but there's a lot of truth to it, right? Just like if I wanted to get my bicep bigger and I would do some bicep curls, kind of your brain thinking of it the same way. And that's how we think about things like the puzzles and lifelong learning and languages. And then yes. Yeah, great question. So the question was about antioxidant supplements to prevent cognitive decline. And again, I kind of will expand it to not just cognition, but thinking about like heart disease, because again, they're tied in. So my first answer is similar to before, is it's always better, if possible, to get things like that through foods themselves. So thinking about foods like blueberries, things like that actually have those antioxidants. And then that it has been shown in that regard because of like things like the MIND diet. The evidence for antioxidants like as supplements kind of goes back and forth depending on kind of the given day. So again, there's not really strong evidence for that one way or another, but it's not also hasn't been shown to have any harm. The question was about known associations with screen time and cognitive decline. I'm not familiar in terms of if there's any kind of studies out there right now. I anticipate probably that will be something more in the future, just thinking about like the age of people that are sort of experiencing that as much. There has been some studies showing that attention has been impaired because of more time on screens and social media and things like that. And so if attention is being impaired from them, I would assume then that would impact cognition over time. Again, though, with the right amount of time and in the right way, technology can also be helpful, right? Though, because I know that, FaceTiming with like a loved one can be really beneficial, right? For your mood and for everything that goes on. Or, playing a certain game can be in small amounts. So I think it's kind of a balance there.
After you pass, like how much
and then I'll repeat the question just to make sure I understand. Do you mean the effects of doing these things or cognitive decline? Cognitive decline. Okay. So the question was that I had mentioned that cognitive decline starts generally in our 40s, and it's a pretty slow but consistent decline. And then we see that after 70s, it can be kind of a steeper decline. So you'll see it'll be kind of more of the same, basically. So more of the, wait, I know this person, who is it? More forgetting names, more trying to find the right word, more I parked my car in a parking garage and it's really, really busy. Kind of where did I park that? More having to write things down. But I always say, though, that once we get into that age group, anything that you're sort of noticing, it's helpful to kind of write it down, think about it, and kind of bring it to your doctor for attention. Because once we get into that age group, we want to be careful that there's normal cognitive decline. But unfortunately, like after age 80, there's about 50% of people start to have true what we call dementia. So it can be a little bit more severe than kind of what we're talking about. It's a great question.
What's your first primary care doctor to geriatric?
Yeah, that's a really good question. So there's like a lot of clinics will have somewhat of strict cutoffs, being like either 65 or 70, although can definitely be variations, and a lot of times we accept people who are younger. What I always say is that geriatric doctors, it's less about a specific age, so that plays into a role, and it's more about sort of complexity. So I have a lot of patients who are 75, for example, and I will tell you there is such a wide spectrum of what 75 can look like. And so when someone starts having a lot of different medical conditions that are, how to say this, that it's hard to balance them because of the different conditions, the different medications, or when there are signs of kind of a worsening cognitive decline, for example, or when there are a lot of physical immobilities and things like that, I say absolutely it's a good idea then to be in with a geriatrician. I also think it's great to get in with one on the earlier side. So like when people just are in their 70s, even if that doesn't apply to them, because then we can start to talk about, okay, what are the next decades ahead look? What can we do for healthy aging as much as possible? Because unfortunately, we'll eventually get older, and everybody in their 80s or 90s, I think, but no access. But just can you repeat that? I'm so sorry. So the question was about what I had mentioned in terms of like the sleeping medications and avoiding. So it depends a little bit on the sleeping medication. And again, not thinking, I know I keep repeating myself, but just I don't want people to get worried. We're not talking about melatonin here, right? Because melatonin is kind of natural. And just to reiterate kind of what you had started to say, your body really doesn't form like a dependence to it. You can psychologically get used to taking melatonin, and then you get worried if you don't have it, but it's not a dependence in the same way that we think about others. So certain sleep medications taken for years have been shown to have a rate of cognitive decline. So like Ambien is a common one, also known as Zolpidem. Anything in like the benzodiazepine category, so Xanax, Ativan, that taken for chronically for years has been shown with a rate of cognitive decline. There are some antidepressants that also are associated with helping people to sleep, and those haven't been shown for that. So if the main treatment is about sort of depression and anxiety, and part of that it can help with sleep, kind of the balancing out of all of that has not been shown to be a concern. Yeah.
So how do you approach issues such as like hearing loss or cognitive decline with loved ones who might be resistant to hearing that like it might have?
That's a really good question. The question was, so how do you approach the topic of like hearing loss and cognitive decline with loved ones who might be a little bit hesitant to accept that they have hearing loss? I have personal and professional experience in that. So first off, it's tough. And then again, when we think about all of these things, it is cumulative. So, and it's not like, okay, if it's delayed by 6 months to a year, it's okay. We have time. So I think it's also appropriate to, and more effective in the long run, to take that time and to kind of let people sort of adjust to the idea. So I would just say that, because from, the loved one's perspective, like when I've seen it with my dad, for example, very much, okay, I want to get this fixed right now. So it's sort of just taking a step back, taking that deep breath, and sort of realizing that it's okay, we can do this right. So that's the first thing I would say. And then I think it depends a little bit on the individual. I think hopefully maybe some of you can use kind of the knowledge that we talked about today in terms of the many different ways that hearing can potentially affect your cognition. And for some people, that's, brand new information. And with that as a possible effect, they might actually be more willing. Say, when I talk to my patients, like the number one thing that I hear is that they are most worried about their cognitive decline, more so than a lot of other things. Because people will be like, oh, I don't need hearing aids. I can hear the TV. I can put it up louder. Yeah, that's true, right? I wouldn't be pushing it if it was just that reason, right? And so sort of that could be one approach, just sort of making sure that they understand the whole picture. And then some of it too is about sort of like access and getting to the appointments and getting the right tests. So I think sort of trying to tease out kind of what is there. I think aligning with that person if they do have a primary care doctor, and I think hopefully we can all try to get one of those, that can be really helpful as well. And then more and more hearing aids are also becoming like better, smaller, like they work with a phone. They're just becoming more common out there too. So I think that's going to generally help kind of move the conversation. But I'd say like focusing on that cognitive piece. For medications, for example, like I have patients that have been on medication for a very long time. And as soon as I mentioned that it could affect their cognition, a lot of times that's the bigger motivator than anything else. So the question was about sort of the long-term effects of like using AirPod Pros, or I guess regular AirPods, I don't know why I said Pros, earbuds, that kind of thing. And I just started smiling because I wonder about it a lot, actually. So I don't have great information. We recently had a talk from an audiologist at UNC, and she's sort of like it's unclear right now, especially because some of the noise canceling effects might actually end up having some benefit. But then the attention part of it, and like the not being sort of in the whatever is going on, probably has some negative side effects. So it's probably going to end up being a mixed picture, but I think we'll have to see. Yeah. Oh, not that I know of, actually, though. That's an interesting question. Yeah.
Do ADHD drugs now have a negative impact?
Specifically Adderall, like I said. So ADHD is also something I feel like is evolving a lot, especially like in my patients, when they were of the age where most ADHD was being diagnosed, it like really wasn't a thing, right? So that's the first thing I'll name, that kind of more of it's being diagnosed in later life. And I think when we think about sort of like the chronic years of of use. This is where, not to keep going back to this, it's always about kind of going back to kind of balancing the possible risks and benefits. So somebody that's on one of those medications because they need it to help them sort of pay attention and work and be in school and be, the possible benefits of that are pretty high. And so probably outweigh then maybe some of the more chronic risks. And I'm speaking strictly to the cognitive decline part, because there are some thought that like chronically with those medications, we want to make sure like that your heart is being monitored and all of that, just to name that. Whereas in sometimes people stay on the medications and they probably didn't need to stay on them. Like maybe their situation changed, maybe they're not in college anymore, et cetera. And so sort of asking that question about, do they really need that medication? The medications themselves aren't in any of those categories that I was talking about that really have been shown to directly like impact and decrease the neurotransmitters in cognitive decline. So I think it's really just kind of asking about how much longer they need to be on the medicine.
I want to cut anyone off if there were any last questions, but we just wanted to say thank you all for coming out, especially on this cold, rainy day. Thank you to everyone on Zoom that showed up. And I just wanted to give a shout out to Shreya, who helped organize this session and found our speakers for tonight. So let's thank her real quick. Our next session is going to be exactly 1 month from today on March 11th on mental health. So if you haven't seen our posters yet, or if you're not on our email list, feel free to speak with one of our people before leaving tonight. Other than that, let's thank our speakers one last time.